Today on Forbes, the big changes to ACA premiums at the heart of the government shutdown. The Affordable Care Act, or ACA, Marketplace Open Enrollment period begins tomorrow, Saturday, November 1st, 2025, in most states, and it's shaping up to be a tricky one. Premiums are going up, and the enhanced premium tax credits that have helped millions of Americans afford healthcare coverage are scheduled to expire at the end of the year. The debate over extending the credits has become a major sticking point in Washington, and one of the reasons for the current federal government shutdown. The issue is that in the Republicans' quote, One Big Beautiful Bill Act they passed in July, they made permanent many other tax breaks and even created some new temporary ones, but did not extend the ACA tax credits. Senate Republicans aren't keen to do so in any short-term funding measure, and Democrats have said they won't support any funding bill that leaves the tax credits out. If you're unemployed or your employer doesn't provide healthcare insurance, or if you're self-employed or own a small business, finding individual coverage can be difficult. The solution, courtesy of the ACA, which is also known as Obamacare, was the creation of health insurance marketplaces. The marketplaces allow individuals to buy health insurance coverage that isn't tied to employment. Marketplaces offer different levels of coverage, and the coverage is private pay, meaning individuals choose and pay for their own coverage. There is a health insurance marketplace in every state. According to the latest count by KFF, a not-for-profit healthcare think tank, 21 states, including California and New York, operate their own marketplaces. In other states, the federal government runs the marketplace, which can be found at healthcare.gov. The marketplace option makes it easier for some groups, like small business owners, to get coverage. The Center for American Progress reports that about 5.2 million small business owners and self-employed Americans are covered through the marketplaces. Marketplace healthcare insurance premiums turned out to be still too high for a lot of people. The solution? Premium tax credits that lowered premium costs. The amount of help you receive depended on your income, age, and the cost of plans in your area. In 2021, Congress expanded these tax credits, but only temporarily. The formula was revised so that lower-income households paid a smaller portion of their income toward their monthly premium. The changes also removed the income cap, allowing people earning more to still qualify for help if their premiums were high relative to their income. Notably, the formula capped what anyone would pay for a benchmark silver plan at about 8.5% of their income. There are 4 kinds of plans: bronze, silver, gold, and platinum. Silver plans, which are the most popular, cover about 70% of healthcare costs. The result is that these tax credits lower the cost of healthcare coverage, and especially so for older adults who face higher premiums. That's because premiums are age-based. Without subsidies, a person who is 52 will pay about twice as much as a person who is 21, and a person who is 64 will pay 3 times as much as a person who is 21. According to KFF, over half of marketplace individual enrollees with incomes over 4 times the federal poverty level, or FPL, are aged 50 to 64. If enhanced subsidies lapse, average premiums for a 64-year-old with income of 401% of FPL will go from $5,328 in 2025 to $16,500 in 2026, according to KFF estimates. If Congress doesn't act, indeed, 2026 could look very different. In addition to the changes already noted, there will no longer be caps on repayment amounts. That is, the amount you have to repay if it turns out, when you file your taxes, you got too big a subsidy. That's especially concerning for people with fluctuating incomes, such as gig workers and the self-employed, who could end up owing thousands of dollars at tax time. Currently, over 4.4 million self-employed persons and small business owners and employees receive tax credits that reduce their premium costs. In general, premiums will also go up. As the result of changes in the law, most marketplace consumers can expect to pay 4.5% higher premiums in 2026, even before the effect of reduced premiums. Those in the marketplace and those on employer-based plans could see an out-of-pocket cap that is 15.2% higher in 2026 than it was in 2025. For full coverage, check out Kelly Phillips Erb's piece on forbes.com. This is Kieran Meadows from Forbes. Thanks for tuning in.